And it's for a good reason why radiology is the first part where AI is making an impact. Because 90% of the healthcare data generated normally is imaging data. These are large, unstructured data sets. To give you a data point, it says that 1/3 of the world's data comes out of healthcare, right? But here comes the crime. We today only leverage 3%, so 97% is going unused some way to a siloed system, and that's the big what I would call a crime we have to focus on, we have to solve, right? AI is helping us to unlock that data, to improve diagnostic accuracy, to streamline workflows, and then ultimately to enhance patient care or patient at the end outcomes.
Good. So, hello, Simon, and welcome to Impulse. I'm, glad we managed to find some time for a chat after, HIMSS Europe in Paris, where we initially got in touch. I have to admit that, very early on when I launched the podcast and when I was looking at potential guests, I was interested in, having one of your colleagues, who is still a colleague of yours. I'm talking about here about your Chief Medical Officer, Professor Matthias Goyen. With whom I was really, interested at the time to learn about, the latest progress and innovation when it comes to imaging and radiology. And I'm sure, we'll be able to cover these things today with you. So we've actually had, in previous episodes, had the opportunity to talk about these topics with a few guests. Some you might know. So I talked, for example, with Oad Arasi from Clarius, Dr. Amin Korshi, he's a radiologist in Geneva, and Andrew Lacey as well from Prenuvo. So at the risk of repeating, myself for our listeners who are joining, I think it's key to understand that the area that is facing some of the most, let's say, transformational changes in terms of technology and care practices is definitely like imaging and radiology. I mean, we've talked earlier about, the number of FDA filings for AI-based applications in that space, and I think it's far ahead. So there are many reasons for that. It's also, I think, due to the fact that medical images were historically one of the first modality of data in medical practice that was digitized, and so on and so forth. And so, yeah, if you're, listening to this and you want to expand your knowledge beyond what we cover, in the episode today, I'll invite you to listen to those conversations as well. So I don't want to make my introduction too long, so I, suggest we move on with the first question I ask every guest on the show, and that is, in your own words, Simon, would you like to present yourself?
Look, first of all, thanks for having me, and I hope I can add also one or two nuggets of wisdom to the discussion in enterprise imaging, radiology, and artificial intelligence. So by accent, you likely have figured I'm from Germany. I spent half of my career outside of the country, but still somehow have this strong accent. Somehow it sticks to me. I'm with GE now for 14 years. So to say, and my role within GE Healthcare is I'm the global marketing officer for our enterprise imaging business. So very simply said, every diagnosis normally starts with a scan, right, with an image. But it's not just images, right? There's so much data points that are hidden in the system today that could help to make a better decision, or even to predict diseases earlier, or detect diseases earlier. And that's what at the end our business is doing. We provide a holistic healthcare information overviews across specialties to healthcare professionals. This includes radiology, cardiology, pathology, oncology, and beyond. Right? The idea is to capture all of these data points, which are today somewhere in a siloed system, bring them together, and then generate insights out of them that we then play back to the healthcare professional to either detect earlier, detect with more security, or take waste out of the system and focus more on healthcare as such and on patient care. That's what the day-to-day is I'm working in.
Sounds good. And just to understand, because when I prepared the episode, I went on the website of GE Healthcare. I looked a bit into all all the indications, you cover all the technologies because, imaging, it's MRI, it's CT, it's ultrasound. And then there's a ton of, software solutions you provide as well for analyzing all this type of information. Are you, in your current role, being, responsible for enterprise imaging? Does this cover, all of these indications, or do you have a particular focus on certain of those?
So you mentioned two important things here. GE is a big ship. We have today more than 5 million devices installed in the world, touching more than 1 billion patients yearly. But this includes not just imaging, MRI, CT, X-ray, ultrasound. We also have respiratory machines. We have got heart rate monitors. It's a big universe. I'm in charge of the software in the imaging space, so to say.
Okay.
So everything that at the end takes the scan data, this could be a GE device or non-GE device, brings it into a backbone where you can structure it and work with it to then help to ease the workflow. That's what we do. Mainly focused today on imaging, but more and more also branching out into wider concepts like cardiology, like digital pathology, like ophthalmology and so forth.
Sounds good. So, I mentioned in the introduction that imaging and, radiology are the area of medicine that is, undergoing a profound change from a technological perspective. And one of these components is, of course, like artificial intelligence. I wanted to ask you, so as an industry leader in the space, when we're thinking about GE Healthcare, what are like some of the, the trends currently you're observing closely, and which are the areas that you are, focusing on from your perspective?
I mean, you're absolutely right. AI is one of the main themes also we in GE Healthcare are focusing on, right? It's likely not just a tool. It will reshape the way how healthcare is provided in my space, also how radiologists and diagnosticians will work in the future. And it's for a good reason why radiology is the first part where AI is making an impact. Because 90% of the healthcare data generated normally is imaging data. These are large, unstructured data sets. To give you a data point, it says that 1/3 of the world's data comes out of healthcare, right? But here comes the crime. We today only leverage 3%, so 97% is going unused somewhere into a silo system, and that's the big what I would call a crime we have to focus on, we have to solve, right? AI is helping us to unlock that data, to improve diagnostic accuracy, to streamline workflows, and then ultimately to enhance patient care or patient at the end outcomes. What do we see as the main trends in the AI space? One for sure is the rise of Agentic AI, which goes beyond the traditional imaging analysis that you mentioned first, right? That was something we work on for quite some time. But now this Agentic AI helps you basically to also take actions, right? From the scanning process to report generation, these models help basically to ease things. There's a potential to dramatically also reduce the workload of radiologists and improve efficiency. That's one. The second one is what I would call cloud-native platforms. That's actually one step before the AI is a cloud as an enabler, right? Because this helps to, at the end, democratize the use of AI. We integrated, for example, some third-party applications into our picture archiving and communication systems, giving clinician access to a curated catalog of various applications, which are not just the ones from GE. And these include areas like stroke detection, lung nodal analysis, mammography, to cover the entire, let's say, patient in a 360 manner. That's a second big trend I see. The third one, then it's literally the use of generative AI and predictive analytics, especially in these moments. It's gaining a lot of traction. If you see what the outcome of the workflow I'm focusing on is, it is a report, right? That either detect disease or not. And in generating this report, there are a lot of tasks that have to happen. we leverage generative AI to automate these tasks, and at the end gives the radiologist, as an example, more time to focus on the real work, on difficult cases, or on patient care. And if you see where we apply that, one is workflow orchestration, right? Using AI to automate repetitive tasks, freeing up time,
Yeah.
as I mentioned. Then in precision diagnostics, so we are fine-tuning our foundation models that are coming to market with real-world data to improve disease detection and to even accelerate that. Right, and then this scalable deployment I also mentioned, which is done building cloud-first modular platforms. That's what I see as the main trends and where we also want to focus on in the coming years.
Very clear. And I have a question actually on the second trend you observed, and how you guys are tackling it. Do you provide cloud solutions for health systems and hospitals, or do you partner with let's say the large tech companies who are known for providing these type of solutions?
I mean, at this point in time, we work with Amazon Web Services. We have a decade-long partnership with Amazon. They are our, let's say, first partner we are leveraging here to roll out the cloud. But having said this, look, this is very much depending on the needs of our customers at the end, which are normally hospital systems, large reading groups, and so forth. Right? We had to start somewhere. That's why we focused on a long term partnership that we already had. In the future, this depends very much on the region and on the patient where the focus will lie, right? But you mentioned an important point here, which is partnerships, right? That's something we believe in, and because in these partnerships, everybody focuses on where they have the biggest difference to make. AWS is a big player in cloud. They know how to establish that. They help us to also develop generative AI. So they focus on their strengths. We focus on our strengths, which is at the end bringing clinical insights to our customers, mainly large healthcare systems, reading groups, and so forth, and to help them basically to ease their workflows.
And so I understand at the moment as well, when you were talking about these trends, so I'll repeat them. There was, agentic AI, there was cloud technologies and predictive AI. I didn't hear, the word hardware. So I'm thinking, is there also a lot of things, or because when I think about imaging, I know that there's also, I've seen, publications for like MRI, for example, that, machines that are extremely powerful, that can reduce the time you spend actually in a machine, have a level of resolution that's really high. Is there, I guess, still a lot of focus maybe in a part of the organization where you are not directly responsible for, or do you think at the level of the organization for GE Healthcare, there's really this focus more on software at the moment? I
mean, look, this is you cannot separate one from the other, I guess. Hence, where you implement the algorithm or the intelligence, right? We are doing this to develop artificial intelligence that is placed on our devices. We do this for quite some time, over 10 years already, right? So if you see the possibilities that are out there, one is you basically embed the algorithm on a device, right? Helping you doing critical tasks there. Examples is our critical care suite as a good example where it helps you to detect a critical disease while you use a mobile X-ray device, right? Collapsed lung, cold pneumothorax. This algorithm is embedded on the device. It helps you to say, hey, we just scanned, for example, he has this condition, he needs treatment directly, right? That's one example where it's embedded on the device. This we do for quite some time. And there are others depending on the modality. You mentioned the over 1,000 approved FDA devices. We roughly are 10% of that, right? Leading. This is one of the very clear-cut examples. The second one is to embed it into the entire workflow, so to say, right? Or into the care episode even, right? If you take oncology, we announced last year at Health in Vegas, and this year we strengthened this message, our Care Intellect solutions, which do exactly that. They cover the entire workspace, for example, in oncology, in neurology, and more to come, right? And then the third let's say, area where you could embed the intelligence is across entire healthcare systems, right? We have a solution called Command Center that where predictive analytics help you to detect bottlenecks, to see how the patient flow goes through the system, right? That's the third, let's say, place where you could put them, right? So it depends a little bit where you want to place the intelligence. So it's not just on devices, right? That's something. Our heritage comes from that. We are a radiology company from the past, right? And that's where we focused on. But now you see that we are broadening this approach across basically this system. So on device, in the care pathway, or in the entire enterprise.
Perfect. So, one of the trend as well that I'm observing, and that also, let's say, I guess, makes sense from a maturity perspective for digital health, where, let's say, over maybe the past 10 years, 15 years, we've seen, a lot of like point solutions provided by different players or even by large companies like G Healthcare. And now there seems to be an approach where, companies want to provide solutions and services that cover, what we call like, that's end to end from a patient journey perspective. So from prevention, screening, diagnosis, management, and eventually, cure or disease management. And I wanted to ask you if you could give us an example, in the case of G Healthcare, if there's like, just to exemplify a bit and give an idea for our listeners of the breadth of technologies that you guys are deploying for that matter. Would you have like one condition? I don't know if it's, you mentioned stroke, oncology, but the other ones where you want to pick up one example to illustrate that?
Let's take the world's number one killer, which is cardiology, right? We in GE Healthcare, we design solutions that follow the full patient journey, from early detection over diagnosis, treatment, and recovery. But that's what the aim is, and that's where the example I'm going to basically cite right now is coming from. So we work together with a company called AliveCore, and they produce this small device here. And I personally use it, not kidding, every day, which is a 6-lead ECG, right, called the Cardia Mobile. With this thing, you basically move healthcare outside of the hospital, not intuitively, into the house, right? Because I can take every morning my ECG here, right, and then I can directly integrate this into our Muse cardiology software. And a real example where we do this is here in my home turf in Germany with the University of Hannover, right, where we integrate this information directly into the workflow. And you can then in real time send this data to the cardiology information system where the cardiologist basically can take action, right, in the Hannover Medical School. What does that bring at the end for the patient? Peace of mind, right? I don't have to. Normally, cardio patients are not always very mobile, right? It's a burden to go to the hospital, right? I can do this easily at home, and I know that my cardiologist can see this in real time. But that's one. Then, technically, faster diagnosis. If I do this every day, if patterns occur, they can be detected, even involving artificial intelligence to say, hey, Simon, your conditions are changing, you likely have to come in, right? It gives me, at the end, normally fewer hospital visits because I'm on a more frequent monitoring, and it empowers me as a patient as well to take my own, health journey into my hands, right? For care teams, it basically helps you to seamlessly integrate the data into your workflow, right? You have the ECG automatically within your EMR, within the way of working that you have in the hospital system. It also helps you to improve coordination, right? Because you don't have all of these ad hoc visits, right? Faster decision making and efficiency gains are big here, right? So one of these major achievements here is to bring cardiac care closer to the patient on the one hand, and on the other hand also to take basically to take pressure out of the system, because these visits that have been basically in the past are not there anymore, because you shift the care outside of the hospital and you in real time integrate the data into your way of working. So that's a very tangible example of how we improve cardiac care basically from early screening to diagnosis.
Yeah, and I think I want to talk maybe a bit later about this ecosystem thinking, and it goes back also to the topic of partnerships. I think it's interesting that you bring up that third part, that device that belongs to a third party company, and actually I forgot the name of the founder of Alive Core, but this is also someone I'd like to talk to at some point.
You should. It's a great device. And look, literally, for me, it's
yeah.
This is
They really transformed the way CGs are done. So I think I wanted to talk a bit about more from a commercial perspective. So we understand let's say there's complexity in how these solutions are operated and are operating and deployed, and I guess there's also complexity in how these solutions are also commercialized and sold to health systems. And keeping in mind what you just explained and this aim to provide services and solutions along the patient journey, and having going back to the trends you mentioned, cloud-based solutions that are technically complex. How does this or how do you approach commercializing these technologies at the scale of GE Healthcare? And that's probably something you're very suited to respond to.
It's a great question, because it's not it's different in the software or enterprise software world than it is in the device world, right, or the hardware world, and that makes my job as CMO here, I think, really fascinating, right? Because if you want to market a flagship imaging device like an MRI scanner, you're telling the story that's quite tangible, so to say. There's a device, there is a machine, right? A big iron. If you market that, it's about speed, image quality, design, clinical outcomes. Like, doctors can touch and feel it, right? They can experience it firsthand. And it comes to enterprise digital platforms like our Genesis portfolio, for example. It's a little bit different, because these are more or less invisible solutions, right? They live in the background. They are quietly powering workflows, they are connecting data, they are enabling care teams to take smarter decisions, but it's just not tangible, right? For us, it's not about the machine. In my world, it's more about the impact. We talk about our platform, how it helps to take faster diagnosis, for example, right? Or how it's streamlining workflows, how it helps you to not just see radiology, but see the connected images of pathology, cardiology, radiology, and other data from the EMR together, right? That's where my job is, to make this invisible, let's say, value visible, right? And how we do that? We focus on real-world outcomes, right? Faster diagnosis, I just said this, fewer repeat exams, better collaboration, and let's say improved patient experiences. And our storytelling is around that. I can give you some examples. Some of our solutions are able to help you to basically increase 20% efficiency of your radiologist. It's a solution called Pace and Balance that helps you to basically assign the right exam to the right radiologist based on skills, based on workload, based on knowledge. So to say, hey, Mathieu is the expert, give him the difficult brain scan. Simon is mainly the newbie, so he can diagnose the fracture, right? And this is done automatically based on an algorithm. That's one. And we say, hey, we lead with the improvement of efficiency there. Another example is I mentioned before the cardiology example. Some of our software will help you to do a standard cardiology report with just 6 clicks, right? This could sound a lot or not, right? But in these kind of environments, every click which matters, right? A click too much basically would take away cognitive, let's say, focus from the healthcare professional. So we lead with that. Hey, basically we can do this 90% faster compared to our older versions, as an example. And the last one is if you take our imaging 360 for operations, our fleet solutions, we are able to help you to basically use 3.7 kilowatt hours less of energy in an MRI scan, which is enough in a year to power 45 homes. And we have tangible examples where we achieved this in the UK. Right? These kind of things in my world play a bigger role, that you have that you quantify the impact in intangible terms. And that's at the end where my marketing is more exciting, I would say, sometimes, right? It's also a little bit more complex, but it is a little bit powerful, if you would ask me.
Yeah, so really kind of like relying on real world outcomes to build, the value proposition. And I was also curious, in terms of like commercial models, because I think going back to the difference you made with, potentially like selling a MRI machine or a big piece of hardware, there's a lot of, flexibility, I guess, you have in how you provide a package or a subscription. And I also have the impression that like most, of the large companies are entering or getting into that, let's say, a similar direction as GE Healthcare, are trying to, or are pursuing, subscription-based models towards, hospitals and health systems. Can you, without, or to the extent of not, breaching any confidentiality, can you tell us a bit how you, see, or how you approach, these commercial models from your enterprise imaging portfolio?
Look, first of all, there's a general trend in the software, in the imaging information technology market, away from so-called capital expenditure models, where you pay up front and then you just pay for the maintenance and for other things on top, to operational, let's say, expenditure models. Software as a service is the example here, and with the movement to the cloud, this will become across the globe, I believe, way more common practice. Right now, we see that in the US and in the UK, this is moving faster than other parts of the world, but this will be a standard going forward. How is this approached? Look, what we do right now is it's depending basically on the number of scans. So you price the number of scans you do, and on the second variable here is what kind of solutions do you want to basically embed in this approach, right? So it is basically a software as a service model, and then you have different packages depending on your type of institution, right? A outsourced reading institution likely doesn't need all of the clinical depths academic hospital would need. So we offer modular packages based on the hospital institution or the use case, so to say. One is, let's say, the package for the imaging center. The other one is the one for the professional, let's say, academic hospital that needs likely more algorithms and more clinical depths. So the idea is to be modular, very important. And secondly, we work with also the number of scans the number of data that is managed at the end.
Generated. Makes sense. So I'd like to go back to the topic of partnerships and ecosystems in healthcare. So what we see in consumer, let's say, tech, like companies that have an approach where they establish like walled gardens, like they keep, let's say, they have they keep the customer locked into a system, like for example Apple, and in the case of healthcare, and that's also something I believe in strongly. I don't think that it's really an approach that work, or maybe it's just either you're like purely focusing on one specific point of the patient journey or just one indication, but then you cannot go beyond that. And so I'd like to, hear a bit your perspective, personally, and also let's say from a perspective of GE Healthcare. How do you go about, building these ecosystems? You mentioned, the example with the work you're doing with the Hannover University and using the LifeCore device. Why do you think this makes sense, and how do you guys, approach that?
Look, I believe that you said basically closed ecosystems might win in consumer tech and in other areas of business. I strongly believe that healthcare is different. Right? And even a large ship like GE will not solve all of the problems a hospital can have. have, right? So no single company can solve all of these massive problems that we have in healthcare, right? Like access, like quality, like waste. There are so many things at the end in our world that I strongly believe you need this approach where each partner place on their knowledge and on their best, right, at eye level. So we believe in this collaborative ecosystem approach where you focus on open and interoperable, let's say, standards, and you also work together achieving certain kind of outcomes, right? That's the idea behind that. We in GE Healthcare, how does this look in my world, right, in the enterprise imaging world? We work with partners that do a certain thing likely better than we do that because they focused on that first, because they have a different kind of knowledge, they have a more advanced technology or whatever that is. So we bring them in. Examples for us right now are, if you take the like data migration to the cloud, we work with a partner called Analytic who help us basically in these AI-powered data migrations. Right? They do this for years. They are very very solid. So that's their core business. We work with them to help our customers to move faster and more structured to the cloud. Right? In the reporting world, we work with a company also based out of Munich here, Smart Reporting, because they have a very tailored solution that helps you to structure and accelerate the reporting in the radiology world, right? I talked about before that we don't only focus on radiology, so we also look into things like digital pathology, which becomes more and more important in the diagnosis. There we have a partner called Tribune Health based out of France. Why? Because they do this for years and they are very solid in that solution. So we believe that if we combine this with our enterprise imaging solutions, 1 + 1 is 3, because they do it very good. They do their part very well. We do our part very well. And I can continue in all of these with even larger partnerships with AWS I mentioned to help us to provide the cloud infrastructure and to also develop our generative AI. We work with NVIDIA to develop autonomous imaging solutions, and we work with partner institutions to bring this all to life. I mean, one initiative we launched recently is the medical advisory board that we lead in our business, where we basically co-create our solutions with advisors around the world. These could be hospital systems, and these could be partners like the one that I mentioned, right? These partnerships at the end help us to deliver this integrated platform that connects data, devices, and diagnostics across the care pathway. And each of them focus on what they do best.
And when it comes to, let's say, early stage startups that are also entering the space where you guys operate, do you have also certain, I don't know if it's like open innovation programs or acceleration programs or ways you can kind of like keep your finger, on the pulse of what's happening and, test as well certain solutions that you see are emerging and that might not be under, let's say, your radar or in your own pipeline?
We had an acceleration program which we paused for a time, basically because we didn't get the full, let's say, outcome that we wanted to get from that, right? But these are so first of all, we collaborate with startups. I mean, and also with scale-ups. I mentioned AliveCore before. That's a scale-up. I would categorize them as a scale-up, but that's more on a one-on-one basis at this point in time. Right?
Yeah.
We participate in hackathons, and we leverage a different kind of ways to get there, but an acceleration program at this point in time we put on pause. Right? We found that other ways work better and more focused for us. We have an AI lab, for example. There is the possibility to also integrate startups into our work, but this is more on a one-on-one basis at this point in time.
Sounds good. So, I also wanted to, let's say, before we move on with the recurring questions, because I'm keeping an eye on the time and it's moving quickly. You mentioned in the beginning these 3 trends you were observing, and I was curious to hear from your perspective if maybe you had some wishes in terms of how you see imaging and radiology, not let's say next year or in 3 years, but more like on a 5-year to 10-year horizon. Are there like certain things from a technological perspective, from a care practice perspective that you wish could be there, or standards that are completely, let's say, not yet fully established.
I mean, look, for me, there are many things that excite me when it comes to technology, but there is one which it doesn't matter to. I mean, you talked about hymns, for example, before, right? I go to the global hymns and also to the regional ones.
Yeah.
One evergreen that always comes up and that I believe we need to solve. This should be the innovation of our decade is the interoperability question, right? So integrating standards like FHIR and so forth is, and following open ecosystems is one thing that we still need to do more to enable all of the other strong technologies like artificial intelligence, like agentic AI and generative
Yeah, for sure.
mentioned. That's one thing which I want to put out there, and I cannot tell enough. This should be the innovation of our decade at this point in time, right? And that's one thing that I think we need to solve in the coming. Second one is literally the acceleration of cloud and cloud native platforms, right? Again, that's the second big enabler, I believe, that helps partly in this interoperability, but also in the acceleration of the development and application of tools like artificial of technologies like artificial intelligence, right? That's the second big one. We did a first step the beginning of this year when we launched our Genesis, so it's our AI first portfolio, but there more has to come. So the move to the cloud has to be accelerated. Other industries went very fast on that one. We in healthcare, we move a little bit slower for good reasons, because it's a very important data sets we treat here. But that's the second, let's say, development where I would love to see faster progress in the coming years. And then you have all of the part of artificial intelligence in the workflow, right? That's also something where I believe it's a technology that receives a lot of hype. But we need to get it faster also into the day-to-day practice of healthcare professionals, right? It's still not where it should be if you compare us to other sectors. These are the three main developments that I would love to see. And then for what I do in my day-to-day, a good example would be what we call autonomous imaging, so that you automate a lot of things in the imaging process, where maybe human beings are not needed anymore, right? Focus the scarce time of the resource human being or a healthcare professional, diagnostician, nurse, to where it makes the biggest difference, which is either on very complex cases or to provide care to the individual, the patient, right? Right now, there are a lot of redundant processes which are done by humans, which you need to automate, right? In the imaging world, this is something we are working on, where I would love to see also progress in the coming years.
Perfect. So actually, on the interoperability piece, not an easy word to say. The next episode I'll record is with someone from the government of Ministry of Social Affairs in Estonia, and they have one of the most advanced health, exactly, in terms of healthcare system. But well, I think in general in terms of digital society, because I understood that the infrastructure they use for accessing healthcare services and data is the same they use for banking, for
the driving license, all of these things there.
Exactly, everything is like centralized. So I'm really looking forward to talk to the person. She's called Janica Merilo. And then on the on the element you mentioned regarding AI workflows, we also did an episode with the Dr. Ricardo Leite, or Ricardo Batista Leite is his full name, from Health AI. He was actually at HIMSS Europe. We recorded with him. And I think it's interesting to hear from his perspective. He's a doctor, and I think he's very much aware of the latest regulations, and his agency and his work is basically to advise governments and health systems on how to deploy AI-based solutions. So I think in the discussion there's probably some good insights to understand the complexity and how we can accelerate in that regard.
Definitely check it out. I will definitely, it goes out.
Nice. So the first frequent question I have for you, Simon, is if you would recommend some resources to our listeners who want to know more about everything we talked about today, and specifically the field in which you work. It can be books, publications, websites. What would be those?
I mean, I always, for myself, where I get my knowledge from, I try to keep things quite simple, right? I follow folks like Eric Topol, right? He's kind of the digital health pope. His book, Deep Medicine and Super Agers, which recently was published, I believe, are really worth checking out. I'm also a big fan of Dr. Bertalan Meshko, medical futurist. All of these are individuals where I take a lot of insights through various channels. I like to also be close to industry associations. You mentioned the Healthcare Information Management System Society. There's SIM in the US too. So that's a big source where I get knowledge from their thought leadership articles, from their content. I'm a big fan of habit stacking. Time is scarce for everybody. So when I do exercise or when I travel, I love podcasts. So your Impulse Health is a good example that you can listen or do easy listening while you are either exercising or you're on the road. If you really want to go deep in the topic of digital health, artificial intelligence, and these solutions, we have a program in GE Healthcare led, but with many partners, called Hello AI, which is a global self-paced educational initiative that basically helps healthcare professionals and patients as well to get comfortable with AI through hands-on accessible learning sessions, right? And that's something I would recommend. These are the main themes that I follow to stay up to date in industry knowledge.
And thanks for sharing. We'll put all the notes in all the links in the show notes. Can you share with us, an anecdote from your work at GE Healthcare, that made you realize the impact that you were having on people's lives, on patients or healthcare professionals with which you work?
I mean, look, I mentioned that before. We are a global provider of medical technology and digital solutions, right? We have over 5 million systems in use. I mentioned this before as well, touching more than 1 billion patients. So I would guess the stories are countless, right? But one for me is a personal one I want to share, right? This year I became the first time in my life a father, right? My son Carl, he was, let's say, even giving my wife and myself surprises before he was born. Right? It was not the easiest path, and his first ultrasound was done by a GE Healthcare Voluson E6 device, and his final scan directly before birth, which was, as I said, it was a process with complication. Was done with a very classic GE Healthcare Logic 200 Pro series. So seeing how this technology helps you to monitor and address health issues even before a child is born, right, was for me for sure a nostalgic moment, right, but very powerful reminder of the real impact that digital health technologies in general have on people's lives, right? And that's some example where I personally was affected, which really made a difference for me.
Yeah, no, I can understand. It's also like, I guess when you work in a healthcare technology company, like unless you are, you have a field role or you visit customers and so on, you see the products, but it has a different meaning when you experience the benefit it brings, or you see it basically in action for your own sake. So thank you for sharing that. My last question is, if you would recommend fellow healthcare innovator as a potential guest, for the show, who would that be, and why would you recommend her or him?
I mean, look, who comes directly to mind is Professor Felix Nenzer from the University Hospital or the University of Duisburg-Essen. Right, we talked about interoperability. He's one of the persons that I know who really brings this to life in a tangible manner. So in reality, not just on PowerPoint.
Yeah.
So he would be for sure a great fellow to have on your show if you want to not just hear the provider perspective where I'm coming from, but the real experience of how powerful it can be to leverage data, and what are the do's and don'ts in getting there, likely. So it's one of the it's very advanced institution. I had the luxury to go there various times, and Felix for sure is a person that can tell you a lot about how data makes an impact in health.
Yeah, that would make it up for a very interesting episode. So maybe I'll reach out to him for the next season. Simon, you've been very generous, with your time. I thought it was very, very interesting. I hope we get to, connect in person again soon, maybe in the next, edition of HIMSS Europe, or maybe at Half, or, some other conferences as well. I get to join. So thank you so much.
Thanks for having me. Very much looking forward to talking to you soon.
Thanks for watching the episode. I hope you enjoyed it. You can subscribe by clicking on the podcast channel at the top right and watch another episode here at the bottom.